This is a Tedoex Media House production.
Okay, so I'll start with, can you just tell us a little bit about your work and yourself?
Well, I'm Christian Happi. I'm a professor of molecular biology and genomics at the Redeemers University in Edo-Osun State in Nigeria. And then I'm also the director of the African Center of Excellence for Genomics of Infectious Diseases. The acronym is ACEGID, and created or co-funded by the World Bank and then the USNIH through funding from the H3 Africa program. We work in the field of infectious diseases generally, but then using genomics as a way to find, solutions to infectious disease problem that plague Africa. And we have been working in this space. Personally, I've been working in this space for the past 20 years, if not more, 21 years. And we just we set up this center, and the center is really the platform for genomic research in Africa. And we have the goal of the center, or the African Center of Excellence for Genomics of Infectious Disease, is create the overarching goal is actually to create an environment that transcends national boundaries, where Africans can come and then do what I call very proactive, and what I call translational, highly high quality translational genomic research for health in Africa. So, and as such, within that platform, we're training, and then the goal, one of the major goals is actually to train a critical mass of well-trained African scientists in the field of genomics that can harness the tools and the knowledge of genomics to address, for elimination or control of infectious disease in Africa. And along the line, we're developing new curricula in genomics, and then more importantly, absolutely addressing creating solutions and tools for public health, and also educating, in the masses in public health. So in the past 5 years, or in the past 7 years of our existence, we've done, we're very young, but but I think one of the most impactful institutions that we could see in the world. This is without bragging, because in 2014, we were in the forefront of the Ebola outbreak in West Africa. We absolutely sequenced the first 99 genomes of Ebola in the world and made it available to the international community. We're talking about whole genome sequencing. Mm-hmm. And that was the very first time they were using, the science community were using whole genome sequencing as a tool to respond to an outbreak or pandemic. And we made this data available freely to the international community, to the community of scientists, so that they can use information to develop countermeasures like drugs, vaccines, and diagnostics. And that was the first time, we pioneered what we call open data access, and that has become the norm today. So we're very happy we did that. It was a big battle with the WHO and other people, but I think we pioneered that because we had Africa interest in mind, and we didn't publish our paper until probably 4 months after we made the data available freely to the international community. So within 4 months of the outbreak in West Africa, we went from using PCR as a way to diagnose, the disease, to develop a rapid diagnostic test, that were able to diagnose Ebola within 10 minutes. Yeah. And that really, the introduction of that test really, was a major turning point to the control and the containment of the outbreak in West Africa, because, at that point, the doctors and then the laboratory technician and scientist school diagnose the virus in every time, and then that really were able to very helpful in triaging the patient and then avoiding, transmission of Ebola in the what they call Ebola testing center. Yeah. So that were very huge innovation that we did within the outbreak, and then also I just want to mention the fact that we spared Nigeria and the world of the major what I'll call one of the largest, what could have been one of the largest health disaster in the world, because we were able, in the case of Nigeria, to detect or to diagnose the disease, in 6 hours. The index case of in Nigeria in 6 hours. And we're able to use that information to help public health authorities in order to contain this outbreak in record time. That singular action of ours and then that technology that we had at that time, we worked with the Nigeria, was very critical in helping Nigerian health authorities to contain that outbreak, because this disease was in a city of 21 million people, which is Lagos. And what could have happened, for instance, if the virus spread in that kind of community. So these are, going back, that's what the kind of thing that we did, as far back in 2014 when we were working on the Ebola outbreak. But then after that, we went on to work on other viral hemorrhagic fevers like Lassa fever, which is a disease that is very endemic in West Africa. We did the largest, we have so far, generated the largest genomic sequence database in the world. By doing that, we've been able to use that one to develop diagnostics, point of care diagnostics also as well for Lassa fever. By the way, the diagnostic that we actually developed during Ebola and then even for Lassa fever have been approved by the US FDA for emergency use, under emergency use authorization. So, and we went on to do a whole lot of things, contain an outbreak of yellow fever in West Africa using microbial metagenomics, which is a new technology that we also developed in order to identify a new outbreak within 48 hours. We identify a new virus. We told the Nigerian health authorities, then they declared an outbreak, and then they successfully contained that outbreak within 2 weeks. Working in that same space, we've been able to do again in 2015, we discovered 2 new viruses in Nigeria. So we call them the Epomavirus 1 and Epomavirus 2. And that was the first time where the new virus was being discovered, in the landscape of virology after 40 years after the last virus was discovered. So we brought in two viruses at the same time. So we've been working in this space, and then now we're in the space of COVID.
So just for our listeners, because a lot of them aren't scientists like you and I are, when you say genomics, in order to sequence about 99 different genomes of Ebola virus, could you clarify a little bit about what that means?
Well, it means, when we talk about sequencing the genomes of the viruses, that we basically lay bare the genetic structure of the virus. That is basically make available, that is reveal the genetic structure of the virus so that people can know exactly what that virus is meant for. And then the importance of that is that there's no countermeasures can be developed if you don't understand the genetic structure of the virus. You cannot do a vaccine if you don't understand the structure of the virus. You can't do an effective drug if you don't understand the structure of the virus. And you can't do an effective diagnostics if you don't understand the structure of the virus. So this is really fundamental and core to anything that we can develop, that you can develop to contain a disease or a pandemic or an outbreak.
So when you get to sequence these viruses, are you getting them from the patients who have had COVID?
Yes, absolutely. For the case of COVID, we're getting them from patients who had COVID, and then that's the reason why we've been able to move very fast in terms of developing this groundbreaking diagnostic that you heard about, and then really changing the narrative for, the narrative. So at least, we went from, as I always say, Africa went from consumer of genetic information or consumer of information of science. We've gone to that position to producers, and then now we've changed the narrative and changed the tide, because now the world isn't a fix. They lack the diagnosis, but we will bring the solution from Africa to help not only Africa, but to help the world.
So in the different diagnostic space, right, there are a variety of different kits that are available. So we have some antibody tests, some PCR based, so polymer chain reaction, and then some of these rapid kits. Could you please explain a little bit about each one, the different ones, what would be the most effective?
Well, first of all, there are different type of tests. So one, the rapid tests out there, some of them are looking at antibodies, but the antibodies does not tell you whether you have the disease or not. So I think you just tell you more or less about exposure. Yes. Even though if you're looking at IgM, then it's still kind of, too sure about antibody because of what we call cross-reaction or cross-reactivity. So you're looking at, somebody exposed, but then there are many viruses that can provide the same level of response from a human being. So you can for sure say that the response you are seeing is absolutely and strictly from COVID-19. So that's a limitation for that. Then the other one is called antigen capture. So whereby you can develop a test that will actually pick viral particles, which is good. So the problem, I mean, I don't know, not a problem. I think the issue with such tests is always related to sensitivity and or the specificity of the test. Then the other set of tests that you will be hearing out there are the ones that are captured in viral particles, viral RNA, which is nucleic acid-based test, where the PCR is one of them. So, and then the Sherlock test that we just developed is also similar to it. So in the sense that the Sherlock test, also captures the virus, the virus nuclear RNA. But then the difference is that when you want to compare that with PCR would need a lot of equipment and instrumentation. PCR will need someone that is highly qualified and highly trained to handle. And then it requires powers, and it requires, cold chain for the reagents and a whole lot of stuff. It requires an extraction kit. Then it makes this test very cumbersome and very expensive. I mean, the cost for a PCR test on the average on the African continent will be about $125. And that's not really sustainable, for Africa. So we thought about developing something like that, similar to PCR, but instead of looking at the instrumentation, we developed something on a simple paper strip. And this type of test for us is very, very adapted for the African continent, because we don't want to be dealing with paper, with power. We don't want to be dealing with highly skilled workers. We don't have the sophisticated instrumentation. We really want to test that, grandma, wherever in Africa, can use it to take care of the grandchild, or anybody in the most remote place in Africa can use. We want a test that can reflect our economy, that reflect the purchasing power of Africa. Since this test that we developed so far, right now, it's still around $3, but we're working hard to push that, the value, push it down toward about $1, or $1.50 maximum, so that can be affordable. And this is kind of tools that African government can afford. And in addition to that, it takes 6 to 8 hours to run a PCR. At least what I say, 6 to 8 hours to go run, from end to end to run one PCR. But this test that we're talking to you about is about 30 minutes, you get your result. So this is a major game changer that we'll bring into the field. And then, and that will help, I would say, not only just flatten the curve, not even just curve, flatten the curve or bending the curve. This is definitely going to be changing the direction, the trajectory of the outbreak of this pandemic.
Yeah, I think what people maybe might not understand is with PCR, you need to keep your reagents at different temperatures. Some of your enzymes have to be at -80. Then some things have to be cold at 4. And then your PCR has to run at different temperatures and really be airtight. So you need very controlled conditions. And sometimes you don't know which different reagents are optimal for you to be able to test this out. And then having the capacity to then image your results to confirm. And that's where the skill really comes in. So are you guys now manufacturing and distributing your COVID test?
Well, we're in the state of validation of the COVID test, and then we want to do the validation to the Africa Center for Disease Control. So once we have the validation, then we need to, and then at the same time we're talking to manufacturer. But one thing that we're talking about, and I want to insist on, is absolutely to do the manufacturing within Africa. In 2014, we developed when we developed the 10-minute rapid diagnosis test for Ebola, there was nobody in Africa to take up, the manufacturing of the test. And eventually we had no choice but to give it out to a US company. And unfortunately, as Africa is, we're the ones buying that again, yet the knowledge was ours. This time along, I think I want the story to be different. So I said, I'm not selling this out. We're not giving it out. So we want that to be produced in Africa and distributed from Africa to the rest of the world. Since then, the announcement, the news of the test went out, I had calls from all over the world. They want to buy this. They want to buy, they want to buy, they want to buy. But I think it's enough. Enough is enough. I think I wanted a situation whereby for the first time, Africa can sell things to the rest of the world.
So do we face any challenges in terms of protecting our own IP from the rest of the world?
No, the IP for this test is protected. We got an IP already. As I told you, this test is already, approved by the US FDA, for emergency use authorization. So the IP is there. So the problem is not the IP. The problem is how do you produce this in the context of Africa? Are Africans ready to take over this test and then produce and then sell to the world? This is a question.
Are you collaborating with other scientists outside of Nigeria?
Oh yeah, absolutely. I'm very collaborative. I got collaborators across West Africa, Central Africa, and even East Africa. Julie Makani in Tanzania is a very good friend of mine. So we do work together. So and then even in Southern Africa. So I do have, and then also have a lot of collaborations, with institutions in Europe and then in the US, for instance. I have a very strong collaboration with University of Cambridge, in the UK. Very strong collaboration with University of San Francisco, where we have QBI,
Yeah.
The Quantitative Bioscience Institute. I'm sure I was on that last week, giving a webinar. I collaborate with, scientists at what I call Stanford, and then Harvard is basically where I was and where I'm still in visiting capacity as a professor. So I think I do a strong collaboration with Harvard and then the Broad Institute and the U.S. Army Department of Defense. So we have a very large network of collaborators across the globe.
Do you have space for Michigan? Maybe we can work something out and we can work together with Michigan.
Yeah, I know my former project manager was from Michigan, so I brought him from Michigan. He used to work for the CDC in Michigan. He worked with me for about 3 years and then went back.
So for the development of the African Center of Excellence, how was the initial cohort trained and what is the funding structure like?
Well, we have, the funding was from the seed funding came from NIH, and eventually the World Bank actually made a big investment into that. So, and then we had a cohort of masters and a cohort of PhDs over 5 years. And then we in the second phase, we've been renewed once, and it will also be renewed by NIH. So and then apart from the masters and PhDs that are doing work, their research work is actually focusing focusing strictly on infectious diseases. So it could be HIV, it could be viral hemorrhagic fever. Some of them do malaria, some of them do bacterial diseases and all parasitic diseases. So we train them at master's and PhD level, but also we also have short courses, specialized short courses that we run, for 3 weeks. In addition for that, we have several cohorts that we've trained for. We have what we call a summer genomic boot camp. So this boot camp is also a genomic boot camp that to train young Africans. So, and then they come in for 2 months on campus, and then all they do is actually to go to school during the summer to just do genomic work. Each person, they have projects that they run, they have research, a question that they try to address. And all of these things are very important. So we've trained over the past 6 years, we've trained over 1,000 young African scientists across the continent, from Tanzania from Central Africa, East Africa, Southern Africa. And we've actually even trained people from India and then even from Bangladesh. So interesting.
So even I can apply for this genomic summer school.
Oh yeah, no, but this year, the training this year because of COVID is not bad. But the next year you can apply. We're pretty open. We're pretty open.
When students apply, who does the funding?
Well, we support some. We have some few scholarships, but we can't afford to support everybody. So we do provide a few scholarships for a few, especially most of the local. But we do, even for those that are coming from outside, we give them some level of scholarship, but we can't afford because this program is very intensive and all you do is to do genomics, bioinformatics, and all of that. So this is very, very expensive program. And the faculties is an international training program. The faculties come from all over the world. They come from the US, they come from Europe, they come from within Africa. So it is a very interesting program.
Oh, that's interesting. I didn't know about that, but I'll look out for it throughout my program. I guess especially in our research, what we usually do is transcriptomics, genomics, proteomics, and metabolomics.
Yeah.
That's what I'm doing right now.
We're setting up a mass spec, and we're starting a very huge proteomic program. So and then that will be done before the end of the year. So and then that definitely, and then we also, along the line, because it's mass spec, you could use that for transcriptomic work or whatever. So I think it's good.
Okay. Wait, so I guess for the podcast, I have to ask you a couple of rapid fire questions that have nothing
Sure.
to do with the science. But this is to keep it light. What is something that's come about from the pandemic that is now part of your daily routine?
Well, it is the fact that I can't sleep. You know, I run a lab. Yeah, I run a lab, and then I got a lot of people who got, and then we work 24/7, and you got to be up there, and then you got, you know, calls coming in at every time, and then the samples coming in at odd hours. So it's a situation where you can't sleep, and because you got staff, you are all alert. Your seven senses or six senses are all alert. I mean, all in. You don't want anything to happen to your staff. You really basically like the mother chicken, you know, watching over the hens. It's a very stressful period because you really not only care for this for all your staff working in the lab, even by extension when they're in their family, you want to make sure everything is okay, and then, you know, it's very stressful.
And what's in a perfect post-pandemic world? Where's the first place you want to go, or the first thing you want to do?
I really have to, I mean, in post-pandemic, I really want to go somewhere in Africa and stay by a beach and relax a little bit.
Zanzibar or Cape Town?
Yeah, maybe Zanzibar or Cape Town. I really just want to go somewhere and then forget a little bit about science and then take some time with my family, because it's such a tough thing on my children because they are schooling from homeschooling and they don't get to see that yet. And then that becomes a big problem. I got to fight to them every day because they're like, well, before the pandemic, you were always traveling. Now you're here, we don't get to see you. So it gets very challenging. I promised them that after this, we're going to have maybe like 2 weeks together. We're not talking about science, just us.
Yeah. And then what's something that's come out of the pandemic that you hope either yourself or we as a society keep forever?
Well, I think, you know, what you can see during the pandemic is also a sense of togetherness where people come together, they can look after one another. I take you the example of the genomic community where I belong. So we have like a platform called GSED where everybody's just submitting his own data, his own sequence data. And then this is exactly the work coming together. We're all looking toward the same direction. We are sharing. It's all about sharing. It's all about supporting. It's all about doing stuff together. So, and I wish the work would be, you know, this kind of, the work will learn from this community and then see how we can all come together to address problems to address problems together. So I think it's very, very, very important. But to talk about, but then to drive the point home for Africa, I think what I want Africa to take out of this is the fact that Africa should learn. And I think at this point, Africa should start thinking about how do you want to produce things locally? How do you want to win yourself from that over-reliance and dependence from China and then to Europe? Africa has so much problem right now because for you to do any testing, PCR or whatever you're talking about, all the reagents and supplies and plastic wares and chemicals, everything comes from overseas. I think if Africa has to learn out of this, is actually to think about how do you want to be self-reliant and how you can integrate your economy, how you can work as a continent. The unity of Africa should actually come together. We do not need, each African country do not need to have the best platform possible. Let's look around, let's look at where things are available and let's leverage those things in order to help ourselves, help one another.
Do you have any insights on, initiatives on the continent for developing a vaccine or treatments?
Not really. Not that I know a lot. Not that I know of that much. Again, it tells you how many Africans are actually contributing to vaccine development. The only reason we are not contributing to vaccine development is because we don't have the facility and then the capacity.
Yes.
So my lab is trying to make a move in that direction because we have the sequencing technologies and everything to do that. But the problem is, you know, it is a lot of resources to develop a vaccine. And then, unfortunately, Africa doesn't have the resources. Not that Africa doesn't have the resources. The point is, Africa doesn't know how to put the resources where his mouth is.
I was having a conversation with someone about how maybe the difference between the infrastructure in the US, in Europe, and even in China is the fact that governments actually fund a lot of the research that's being done. And I think generally speaking, our governments are not funding any of this research, and a lot of our facilities are either they don't have enough, so they don't have sufficient funding to do some of this cutting edge work. And so it's so difficult for them to devote resources or to do this extensive work, right? Part of science is we have a lot of failure in our research.
I don't think that, you know, that the government don't have the funding. I think it's always prioritization. If you look at it very well, I think African government, we run very expensive governments. So I think it's all about prioritization. I see no reason why we shouldn't be prioritizing and then setting our priorities. Africans, you see them, they're always flying. The government officials are always flying all over, wasting money and then doing nothing. And then you see most Africans, they prefer to have houses overseas. You know, I mean, it's all about lacking the priorities, missing priorities, you know, and it's very wrong. It's very wrong. We have the resources. We're not just allocating the resources where they're supposed to be.
Yeah, there's very little respect given to scientists or even to the importance of science. I think globally, even with respect to the coronavirus, a lot of people fail to recognize the role of science in developing these therapies and, you know, tests that are beneficial for the whole of society, because there's no economy if people are sick or people are dead. And who comes up with these therapies? And it's scientists, and, you know, it's a work that needs to be invested in a lot more for us as a whole society to really function at a high level. Well, that's fine. I think those are most of the questions that I do have. I really do appreciate you taking time out to have a conversation with me. It means a lot. And I'm looking forward to so many people getting to hear these African stories and these solutions that we've done ourselves.
But that's what I'm doing these days. I'm making sure that I'm telling the whole world when I'm talking to the BBC and all those things, I'm always bringing that African perspective, because I've always told people, I think it is enough, you know, for the rest of the world to be telling Africa stories. I think it is time for Africans to tell, you know, stories from Africa with the Africa perspective and Africa flavor. And
we have our own nuance.
We've come a long way. Yeah. And then we need to own up to our own stories. We need to be telling the story from our own lenses. And then we need to, as I told people, we need to own up what is ours. And I think, you know, I've told people before that Africans should be very proud. I mean, I was giving a story. I was giving a talk at the University of San Francisco, California, and I was telling them how proud African I am. I said, look, I'm proud African for my heritage, but I'm also proud of the fact that, you know, apart from my black skin and my black African heritage, I am proud that God has blessed Africa with natural resources. God has blessed us with a lot of human resources, but God is also giving us a lot of blessings with all the viruses and pathogens. We should be proud, you know, to own up to those viruses. We shouldn't just be looking at those viruses as challenges or problems. They are actually blessings in disguise, because we should be the one exporting solutions for pandemics like this one. We should be the one using those viruses and to develop countermeasures. So I think I keep telling them, I'm proud of, you know, our viruses. I'm proud of our parasite. I'm proud of everything that we do.
So I will let you go and enjoy the rest of your day, but I really do appreciate it.
No problem. Thank you very much. And then keep up the good job. I'm so proud of you seeing this. This is what we need. You know, we need people like you out there. We need a critical mass of voices, you know, because this is our time. We need to let people know that, look, we also can put up stories out there. We can also let the people know what is going on. I think it's enough to have people coming from the BBC, from all over the place, from all these news outlets, and describe Africa in their own lenses. It is time to be positive about Africa and to talk about Africa, unity, the integration of Africa, because that's what is missing. You know, Africa, the politicians are talking out there, but I think Africans in the diaspora and Africa academic, we need to start talking about, you know, Africa academic integration and Africa academic unity. Where, I mean, this is a continent where knowledge is caged, and we cannot succeed if there's no brain circulation. I think it's very high time to start talking about and promoting that. I've gone to the African Union before, and I challenged the African head of state, and I told them that you're talking about the Africa unity and integration of Africa. You're talking about the African passport. I told them that if you have to issue an African passport, issue an academic passport for Africans, because I think I've had enough for being caged. I told them that it's easier for me to go from here to Europe, or from here to Australia, from here to the US, than here to other African countries, because we inherited all of these stupid colonial rules and borders, and we make life much more complicated for an African to move from one African country to the other. And you cannot build a continent like this. Knowledge in Africa is caged. There's no brain circulation. We can share our knowledge much more faster with Europe and America than to share with another country, with another African countries. And I don't understand the reason.
That is true. Okay. So thank you so much, Christian.
All right.
So for our listeners, could you please tell us where people can reach you on social media or via email?
I think, you know, I'm not too much. My email is happipIc@run.edu.ng. So I'm not too much of a social media freak. I have only a Twitter account, and that is at Christian_Happi. And then you can also reach me at at ACEGID. You know, those are the two platforms where you can reach me.
Thank you so much. This was lovely having you.